this video, I will tell you why people get acne, good and bad ways to get rid of acne, what to say and what not to say someone with acne, how to feel confident with acne, and what is the history of acne. Enjoy the show! Acne is a common skin condition where the pores of your skin become blocked by hair, sebum, bacteria, and dead skin cells. Those blackheads produce blackheads, whiteheads, nodules, and other types of pimples. If you have acne, know you're not alone. It's the most common skin condition that people experience. It's estimated that 80% of people ages 11 to 30 will have at least a mild form of acne, and most people are affected by it at some point in their lives. Who does acne affect? Though it mainly affects teenagers and young adults undergoing hormonal changes, many people continue struggling with acne into their 20s, 30s, and beyond. Some even develop acne for the first time as adults. The most common spots where you might have acne are your face, forehead, chest, shoulders, and upper back. Oil glands are all over your body, but those are the places where there are the most. The best way to treat acne depends on how severe it is. Acne can be mild, moderate, or severe. Acne can take several forms. They include blackheads, open bumps on the skin that fill with excess oil and dead skin. They look as if dirt has deposited in the damp, but the dark spots are actually caused by an irregular light reflection of the clogged follicle. Whiteheads, bumps that remain closed by oil and dead skin. Papules, small red or pink bumps that become inflamed. Fungal acne. This type occurs when an excess of yeast develops in the hair follicles. They become itchy and inflamed. Nodules, solid pimples that are deep in your skin. They are large and painful. Cysts, pus-filled pimples. This can cause scars. All of these forms of acne can affect your self-esteem. It's best to seek help from your healthcare provider early so they can help determine the best treatment options for you. Acne is a hormonal condition that's driven by androgen hormones, which typically becomes active during the teenage and young adult years. Sensitivity to these hormones, combined with surface bacteria on the skin and fatty acids within oil glands, can result in acne. Certain things can cause acne and make it worse. Fluctuating hormone levels around the time of a woman's period, picking at acne sores, clothing and headgear like hats and sports helmets, air pollution and certain weather conditions, especially high humidity, using oily or greasy personal care products, or working in an area where you readily come in contact with grease. Stress, which increases the hormone cortisol, can also cause acne to flare. Some medications and genetics. Some studies have linked particular foods and diets to acne. Skim milk, whey protein, and diets high in sugar may contribute to acne flares. Chocolate has not been directly linked to acne. One of the causes of acne is a surge in hormones called androgens, which both women and men produce. Those hormones tend to be at their peak during the teen years. For the most part, hormonal changes in the body drive acne. There is some evidence that skim milk, whey protein, and diets high in sugar may cause acne breakouts, although this remains controversial. Eating a balanced, nutritious diet with plenty of fresh fruits and vegetables, especially those rich with Vitamin C and beta-carotene help reduce inflammations. There is also some evidence that eating fish can help. Acne does sometimes result in scarring. It happens when the acne penetrates the skin and damages the deeper layers. Inflammation makes the acne pores swell and breakdown occurs in the wall of the pore. Scarring can, of course, be a source of anxiety, which is normal. But before it can be treated, your healthcare provider will determine the types of acne cause this cause. There are several available treatment options: chemical peels, dermabrasions, laser resurfacing, cleaning, and surgery can all be used to treat acne scars. Your healthcare provider can diagnose acne during a skin exam. They may also ask if you're undergoing significant stress or if you have a family history of acne, all of which are risk factors. Teenage girls and women may also be asked about their menstrual cycles, as breakouts are sometimes related. Sudden severe acne outbreaks in older people can sometimes signal another underlying disease that requires medical attention. Your healthcare provider may suggest that some non-prescription medications for your condition, depending on the condition's severity, your age, the type of acne you have, and how effective the over-the-counter remedies have been. You may need stronger prescription medications. Various medications and therapies have proven to be effective. They target the underlying factors that contribute to acne. You might require at least one or multiple, depending on the severity of your condition. Depending on your condition, your healthcare provider might suggest one of these specialized therapies, possibly combined with medication. Steroids. Steroids can be used to treat severe acne or inject into large nodules to reduce inflammation. Lasers. Currently, lasers are primarily used to treat acne scars. A laser delivers heat to the scar, collagen under the skin. This relies on the body's wound healing response to create new healthy collagen. This encourages the growth of new skin to replace it. There are different types of lasers: resurfacing, ablative, and non-ablative. Your dermatologist will determine which type is best for your skin type and nature of acne scars. Chemical peels. This treatment uses special chemicals to remove the top layers of old skin. Typically, whenever the top layer is removed, the new skin that grows in is smoother and can lessen acne scars. Preventing acne is difficult, if not impossible, during normal hormonal changes, but some things can help. Wash your face daily with warm water and a mild facial cleanser. Routinely use moisturizer. You don't have to stop using makeup, but try to use non-comedogenic products and remove makeup at the end of each day. Keep your hands away from your face. Many topical and oral acne treatments are contraindicated during pregnancy. If you're a woman in your childbearing years, it's important to discuss acne treatments with your healthcare provider and alert them if you become pregnant. Isotretinoin is known to cause severe birth defects, and therefore two methods of birth control are required while on this medication. Hormone therapy is helpful for some women with acne, especially for those that flare up with menstruation and those with signs and symptoms of excess estrogen. Hormone therapy consists of low-dose estrogen, a progesterone, or a medication called spironolactone that blocks the effects of male hormones at the level of the hair follicles and oil glands. Acne is a disease unique to humans and is associated with sebaceous glands that are found at high density on the scalp, forehead, and face. Despite being a near universal problem in adolescents, The reason why such troublesome sebaceous glands exist at all is not well understood. Some interesting theories have been postulated, including roles for skin maintenance, immunity function, and perhaps even pheromones. But prepubertal skin, which has sebaceous glands that are largely inactive, is healthy. Dystocia obstructed labor is unique to humans, and no other animal has as much trouble giving birth. This is thought to reflect the relatively large human fetal head and proportionally small maternal pelvis. Noting the high density of sebaceous glands on the face, chest, and back, there are exactly the same structures that pose the greatest obstructions during childbirth. Sebaceous glands develop after the fourth month of gestation and are large and well developed at birth. Sebum production is also relatively high at birth. Having extra lubrication on these sites would help make the baby more slippery for birth, conferring a selective advantage to successful delivery. As does the presence of the Berning's caseous which a white creamy substance unique to humans that coats newborn infants. Sebaceous glands are thought to have multiple biological functions, including hormonal and immunity modulation, but their exact role remains unclear. Skin with no sebaceous gland activity, namely palms and soles, function well without them, as does the skin of pre-adolescent children whose sebaceous glands are largely inactive. The pathogenesis of acne is an interplay between four key processes: increased production of sebum, blockage of the pilosebaceous unit, increased inflammation, and increased amount of bacteria. However, the exact sequences of events is still unknown due to the complexity of this disease. Mature sebaceous glands produce sebum, which is released into the inflammation portion of the hair follicle. This is above the insertion of the follicle and means that production of sebum is not interrupted by the hair cycle. The sebum produced by the sebaceous glands is a light yellow viscous fluid of extraordinary complexity. The exposition of sebum is different among species, possibly due to the different function that sebum fulfills for different species, and human sebum is unique. 10 things not to say to someone with acne. You just need to wash your face more often. This is hurtful, even if you don't mean it to be. You're suggesting a lack of personal hygiene when that the person is dirty. A person with acne may wash their face 2 or 3 times a day. There are fastidious about keeping their skin clean, but they still break out. It's a myth that acne is caused by a dirty face. It's actually caused by a combination of factors including hormonal changes, inflammation, stress, bacteria, and sebum production. What happened to your face? This remark cuts to the quick. Acne is extremely distressing. Drawing attention to it is in such a way is humiliating. Why don't you try proactive? According to the ads, all people have to do is use an over-the-counter acne treatment products and acne will quickly vanish. Everyone wishes that were true, but it's not. You must be touching your face too much. The assumption here is that the person with acne must be doing something to cause their skin to break out. Comments like this make them feel like they are somehow to blame for their skin condition. Touching your face, while not particularly helpful, isn't the cause of acne. In reality, acne happens for reasons beyond the person's control. You will grow out of it. You're probably right, but with all the good teen acne treatments out there, there's really no reason to wait until acne decides to go away on its own. Starting treatments now will help a teen feel better about their skin and themselves. Stop eating junk food. Junk food is low in nutrition, but it really doesn't have much to do with acne breakouts. There is no scientific proof that eating junk food causes acne. Wow, that whitehead is huge. This isn't something that person can easily remedy, such as getting spinach out of the teeth if you point it out. There's not much a person can do for that big whitehead except wait for it to go away, so remarking on it just embarrasses them. You should try a treatment that worked really well for my friend. Odds are the person with acne has already tried dozens of treatments. It's important for you to understand that not every treatment works for everyone. I've never had acne because You are lucky that you never had to worry about your skin. Some people are predisposed to acne and some aren't. A person's genetics play a role, as do hormones. You know how best to care for your skin. Recognize that the person with acne knows the best way to care for theirs. Have you ever thought about seeing a dermatologist? The person with acne might actually welcome this suggestion, but it depends on how well they know you. Close friends and relatives can broach the subject, but it is touchy for casual acquaintances. You don't know the situation. Maybe the person is already under the dermatologist's care. If you're not sure, then you're definitely not close enough to them to make the suggestion. But if you know them well and you approach them with love, caring, and tact, this suggestion might be just the push they need to make that appointment to help get their acne under control. They may be so dejected and discouraged that they wouldn't know step the okay next. Bring up the subject in a sensitive and compassionate way. Then they will know you care about their well-being, that you are not judging them, and that you are supportive. Acne is not contagious. There are some skin problems that are contagious, but acne isn't one of them. Common acne can be passed from person to person like a cold or flu can. You can touch, hug, and kiss someone with acne without fear of catching the skin disorder. You can even share the same towel or soap with someone who has acne without fear. You will not develop pimples because you can catch acne. Acne is an incredibly common skin problem. Nearly every person will develop some level of acne at some point in their lives. So, just because you develop a pimple a week or two after hanging out with someone with acne doesn't mean you caught pimples from them. Coincidental, maybe, but the origination of your acne? No. How to talk to friends and family about acne? If acne affects as much as 90% of the population, why are so many of us still unsure how to talk about it? The answer may at least partially lie in the fact that our skin health is so entwined with our mental health. Having acne predisposes us for all kinds of psychological challenges, from anxiety and depression to social avoidance. So it's not surprised it can be a touchy subject. Research indicates that people who have acne often find it difficult to talk to friends and family about their skin condition because they are afraid of being judged or hurt. On the other side, people are frequently unsure about what they can and can't say to a loved one with acne. Don't make comments about their skin. Studies show that acne patients feel that the relationships suffer from people asking questions or making comments about the acne. Unless they ask you directly, pointing out the status of someone's breakout is not helpful. This may seem obvious, but keeping tabs on a person's pimples is overstepping in all cases, even if you're pointing out that the acne isn't so bad that day. However, if your friend or family member has been open about sharing their skin health journey with you, and they bring it up in conversation, it's perfectly fine to offer words of encouragement. Do listen if they open up about their acne. Someone what we need Sometimes what we need most from a friend or loved one is simply to be heard. Talking through feeling is a common way for people to process stress, and lowering those cortisol levels can actually help encourage skin health. If your friends or family member ask for your opinion about the acne, try one of these conversation techniques. Practice empathy without judgment. Simply saying, "I'm really sorry you have to deal with this," is often all a person needs to hear. Don't offer unsolicited advice. It's only natural to want to share tips about treatments and products, but what works for you isn't necessarily what will work for others. Not to mention that it's presumptuous to assume that your friends or family members is actively seeking skin solution. Everyone's skin is different, and your friends may have underlying medical circumstances contributing to their skin condition. If you have additional medical concerns about your friends or family member, it's okay to gently mention that you observe is a non-critical way to share your skin health journey if they ask. Delving into your own acne success story out of nowhere is pretty insensitive, but if your friend or loved one asks about it, go right ahead. Just don't be overly insistent that they follow your exact protocol or any protocol at all for the matters. Taking control of skin health is a personal decision that your loved one cannot be pressed into. Encourage gently, but then back off. Don't complain about a pimple to someone with chronic acne. While this instinct might come from a place of empathy, wanting to find some common ground with your friends or family member, there's just no comparing an occasional pimple popping up to the daily struggle with consistent acne. Pointing out your minor breakout will indicate that you can now relate to what another person is going through is presumptuous and potentially alienating for your loved one, the opposite of what you're trying to achieve. Do take care of your own skin. If you have experience managing your own acne, or even if you never had a pimple, lead by example. Sticking to your own consistent skincare routine without preaching can send a powerful message to those around you, whenever they conscientiously realize it or not. What's the difference between popping and picking a pimple? We often use these terms pretty interchangeably, but popping a pimple is different from picking a pimple. Popping serves a purpose. Ideally, when you pop a pimple, you're doing so methodically. The goal is to extract the contents with the hopes that it will heal more quickly. Picking is more mindless. When you thoughtlessly pick at a pimple, you're more likely to irritate it and create a bigger wound. When picking pimples becomes compulsive, it's known as excoriation disorder or dermatillomania. This is a serious condition that can leave permanent scars. So if you or someone you know might be experiencing signs, talk to a professional. Find more information and resources here. Whatever the reason you pick at your acne, we'll be the first to say, "We get it. The urge to pick at acne is a mighty one, but we also have news for you. Giving into this urge not only causes damage to your skin, but also makes your pimples hang around much longer than if you would simply left the spots alone. Why is picking at pimples so bad for you? This isn't just a plot by aestheticians and dermatologists to get you in for a visit. There are so many reasons why picking at pimples is bad for your skin. Picking is unsanitary. It's likely you're either absently picking at your skin throughout the day and you're picking with intention in front of a mirror. In both cases, you're probably using your fingers and fingernails, which carry with them the day's dirt, oil, and bacteria. Simply put, picking is unsanitary, and the introduction of new bacteria to already damaged tissue could lead to infection. Picking causes further breakouts. Having your fingers on your face doesn't lead to clearer skin. In fact, that oil and bacteria we mentioned above gets passed from your fingers to your skin, leading to more breakouts. Also, if you pick to the top of an inflamed pimple, you may be bursting the pustule sac and ejecting pus, sebum, or bacteria willy-nilly. What that happens, the pustular contents can migrate into other pores, spreading acne beyond the confines of the original spot. Picking causes skin discoloration. This is where picking truly leaves its lasting mark. You may think that you're eradicating that annoying pimple, but you might be creating long-term hyperpigmentation, even scarring instead. Sometimes dark marks don't go away in time, and if your picking is enthusiastic enough, you could end up with a healing problem that creates a permanent scar. How do you stop picking and pimples? While it may seem a daunting task, it is possible to curb your urge to pick at your acne. Here's what you can do to get started. Manage your acne. If you're prone to pimple picking, the first step is to get your acne under control. If you've been using a regime for a couple months without much result, or you're worried about scarring, visit a dermatologist. They can assess what's going on and prescribe other drugs if needed. Spot treat. For larger areas on both face and body, try fat masking with sulfur and salicylic acid that will not dry out the skin. Set reminders. Once your acne is under control, you may discover that your desire to pick disappears right along with your pimples. However, you will find yourself still picking at your skin despite a decrease in bumps. You may want to ask for a friend or coworker to monitor your picking so you become more conscious of the habit. Vitamins and minerals are a vital part of our physical health, but how do they often affect our skin? Are vitamins for acne a good idea or not? Vitamins can play a role in your skincare routine, but their primary function should be supplemental rather than the primary means of treatment. When combined with other acne-fighting ingredients, vitamins can help your skin stay clear and be better prepared to avoid future breakouts. There are a lot of details to consider when it comes to using vitamins for acne and to better your skin, including understanding which vitamins do and do not make a difference. Let's take a closer look at what you need to know to make a decision about which products will work for you. Vitamins and minerals can be found in both topical acne treatments and supplements meant for oral ingestion, and their efficiency depends on which type of vitamins you're using. In general, vitamins and minerals in your diet have been shown to play a role in the development of acne, and supplementing these vitamins in some way can help improve the health of your skin. But you will need to make sure you choose your vitamins wisely, as using aggressive products or too much of the wrong vitamin can set you up for failure rather than success. If you are dealing with a particularly deep, unpleasant pimple that can be treated overnight with a steroid injection at the dermatologist. There are 3 root causes of acne: inflammation, acne-causing bacteria, excess oil, sebum production. There is some evidence to suggest that deficiency in some vitamins, namely vitamins A and E, may play a role in the development or progression of acne. Though these vitamins may not cause acne, they may contribute to some of the causes listed above. So it stands to reason that supplementing these vitamins in your routine could help your skin. Studies show that exposure to excess amounts of some vitamins like vitamins B20 or B6 can actually lead to more breakouts or skin concerns. Even if those vitamins don't cause acne themselves, they can exacerbate pre-existing blemishes and make your skin more likely to break out again. It's important to distinguish between taking vitamins via oral ingestion and using them in topical skincare products. Cleansers, serums, moisturizers that are formulated via with vitamins and minerals can help boost the look and feel of your skin, but unless they also use ingredients that can directly target all 3 of the root causes of acne mentioned above, they will not get rid of your breakouts. Likewise, taking a vitamin supplement to prevent or treat your acne isn't going to be enough to get rid of your acne. Instead, a well-formulated supplement should work to complement a pre-existing routine that adequately addresses your skin concerns. Vitamin A is a well-known superhero when it comes to skincare. If you're interested in trying vitamins for acne, vitamin A is one of the first places you should turn. Vitamin A can both help lower inflammation and increase skin self-growth to promote healing and rejuvenation. This makes vitamin A great for acne scars and generally smoothing the skin. Vitamin A derivatives, namely retinol, on the other hand, is a somewhat risky topical ingredient. Retinol increases cell turnover and causes photosensitivity, or a high demand sensitivity to the sun's rays. Because photosensitivity can be quite problematic, we recommend sticking with vitamin A or using azelaic acid to increase cell turnover without the worrisome side effects. Vitamin E. Vitamin E is commonly turned to for its anti-inflammatory properties and its ability to help promote cell regeneration. Some research shows that vitamin E can indeed improve the appearance of acne and breakouts, even severe acne, and successfully lower the amount of inflammation on the skin. Less inflammation means better and faster healing and a lower chance of causing scarring. Studies reveal that zinc, especially in combination with vitamin A, seems to be very beneficial for breakouts and improving acne. Oral ingestion of zinc and vitamin A together is a great way to help your skin stay inflammation-free, stable, and able to accept the benefits of your other skincare products. Skincare benefits that are commonly associated with honey include the ability to fight and kill bacteria alongside anti-inflammatory properties. But there isn't evidence to suggest that it's good for treating acne. Honey simply isn't enough to get rid of or prevent acne. Honey is often thought as good for acne because it's believed to balance bacteria levels on the skin, promote healing, and lower inflammation, but there is no evidence to suggest that honey alone can get rid of acne. While certain properties of honey have ancillary helped some people calm and soothe their skin, it most likely will not cure your acne, and it probably will not do anything to change the long-term health and vitality of your skin. Like many natural remedies out there, honey has been used for ages to try and prevent acne and remove blemishes that already exist. This creates the misconception that things like honey face masks, honey spot treatments are sufficient treatment options for managing acne. But the simple truth is that trying to use honey for acne will not get you far, even if it does potentially have a few things it brings to the table. This is because acne is complex. It's not caused by bacteria alone. Rather, an overgrowth of certain bacteria is only one of the causes of acne. Instead of spending time, money, and effort on finding the best honey-based treatment solution for your acne, it's far wiser to turn to products, including those offered here, that have been formulated to do far more than what honey alone can offer. Let's take a deeper dive into some of the most commonly referenced benefits of honey for skin and analyze to what extent they are true, what risks they may pose, and what alternatives you can use instead to accomplish the same goal. Battling bacteria. The bacteria primarily associated with acne always live on our skin and consume the oil naturally produced as a food source. Not all bacteria are bad for you, but when too much is present, the balance that usually exists on healthy skin is disrupted. As a result, products that can limit or halt the overproduction of bacteria tend to help promote clear skin. Some research suggests that honey does have an inhibitory effect on approximately 60 species of bacteria and is bacteriostatic, which means it in theory can help promote a healthy balance. But simply putting honey on your face isn't enough to get rid of your acne, even if it does manage to kill some of the extra bacteria on your skin. Fighting inflammation. Also significant is honey's ability to act as an anti-inflammatory agent, which many believe makes it a great choice for keeping your breakouts at bay. However, again, inflammation is merely one piece of the puzzle. Something that calms down redness simply isn't enough to treat your acne. Honey's ability to lower inflammation doesn't carry the same long-term benefits and changes to your skin that specifically formulated acne treatments, including the Basis Exposed Skincare Kit, do. Manuka honey for acne. You may discover that Manuka honey is even more heavily pushed as an acne treatment option than regular honey is, and there is a good reason why. Manuka honey comes from bushes similar to those used for tea tree oil. Tea tree oil is one of the most popular essential oil for acne, and it is commonly ingredient onto acne treatment products like acne treatment serum because it reduces acne bacteria. Manuka honey has been shown to have powerful antibacterial properties, but like all honey in general, Manuka honey isn't going to get rid of your acne. Its potentially antibacterial properties aside, it's not going to do enough to manage inflammation, cleanse your skin of other pollutants, shrink your pores, and so on. Few ways to stay confident with acne. Quit comparing yourself to Instagram hotties. Right, so this is a big one, especially right now at the age of social media where everything is perfectly photoshopped with the exact right angles and filters. Comparing yourself to these impossible standards of beauty is absolutely ridiculous. Most of what we see online isn't real, and comparing your realistic self to something unrealistic just isn't fair to you. Don't worry what others might think. Surround yourself with loving, caring people who want the best for you. Never ever feel like you have to stay in a toxic relationship with a boyfriend or a friend who is creating feelings of insecurity within yourself. Believe it or not, people don't care about your acne. That's right, I said it. No one cares. Everyone has their own insecurity, and most of the time, people are too focused on their own to even notice yours. Think about it. Do you notice when someone else has acne? Probably not. That's because we are more interested in how the person acts and who they are and what they look like. Avoid withdrawing from social interaction. Is staying home from date night or a big party really going to make you feel any better about the pimple? No, it's not. It's just going to reinforce the idea that having acne is embarrassing or shameful, making you feel more anxious and self-conscious. And eventually, you will find yourself opting to stay home more and more often. Instead, regardless of your skin, force yourself to go out there and live your life. How disappointing would it be to miss out on big events like graduation, a first date, a concert, or a sports game because you were too worried about your skin? What would you tell your best friends, your sister, or your future children if they were in the same situation? Most likely to suck it up and not miss out. Well, I'm telling you the same thing. Feeling great. One thing to feeling confident is feeling great, feeling happy. If you don't know yet, learn what makes you happy. Go ahead and try it out and take note of how you feel doing that activity. Whenever it's keeping active and playing sports or even sleeping, being happy is a great feeling when you are happy and you can be more yourself and have fun. Take care and pamper yourself. Have a bath, paint your nails, go for a massage, do a face mask, get sleep. It's great to care for others, but you also need to set time aside for yourself. Make a day for yourself. Sometimes feeling confident means cleaning yourself up. Listen to music. Listening to music helps to make you feel carefree. Feeling carefree is also important when boosting confidence, not caring what others think of you and who is looking at you and who is talking about you. Delete all negativity. Negativity that surrounds you can make you feel stressed out, and it can also bring your confidence down. Surround yourself with positivity and you will notice a major difference. This is the most definite confidence booster. Do what you want. The final tip for gaining confidence in your skin is to do what pleases you and what you desire. If you want to do something, do it. If you want to wear makeup, do it. If you don't, then don't. It's your life and your choice. Embrace what you have. Whenever you have clear skin or acne-prone skin, embrace it. If you have stubborn acne, there is not much you can do to change that. Acceptance is key. Acne can cause you stress, feeling like everyone is staring at you, talking about you. Just accept it. You can only do so much, and for the rest, you just have to let your body naturally fight it. Smile and be happy. Who cares about who is looking at you and talking about you whenever you have acne or not? That will always happen. This bump is your life story. It's nothing but a frustrating but that will make me stronger as a person. Fighting along this battle that it seems I am often losing gets exhausting, especially after dealing with it for years. But it makes me thankful for things I never even thought about before my breakout. It makes me thankful for the days I had clear skin and didn't appreciate it. It makes me thankful that I can look back at someday and say, man, that sucked, but I learned from it. But most of all, I have had to learn to feel beautiful with the scars and blemishes. Who I am as a person did not change, even though my appearance did. And it made me truly realize that someone's inner beauty is what made their exterior beautiful, not the amount of makeup or the lack of pimples. This is something you, anyone who suffers from it will move past, and we will be stronger for it in the end. Acne through the ages. Greek physicians Aristotle and Hippocrates used the Greek words iontoi and varus to describe acne as a condition that is strongly associated with puberty. In fact, the singular form of iontoi translates to the onset of birth growth. In the Ebers Papyrus, ancient Egyptians used the term akut, which means boil, blains, sore, pustules, or any inflamed swelling. Given its phonetic resemblance to the term we use today, this likely represents the root word of acne. The term acne vulgaris was first used by French in AD 40 and has persisted to the present day. Skin disease was historically seen as a manifestation of internal problems and thought to represent the need to balance the four humors defined the ancient Greek medicine. Humors existed as liquids within the body were identified as blood, phlegm, black bile, and yellow bile. Pores in the skin were regarded as orifices through which humors could pass. In the 16th century, Sir Thomas Eliot, in his Castle of Health, described the condition due to an imbalance of melancholy blood. Eliot may have seen acne as part of a wider endocrinological syndrome because he describes obesity of the upper body that is associated with boils, increased iron, and black spots. In the 19th century, Robert William and Thomas Peterman, who was regarded by some as the fathers of modern dermatology, divided acne into four types based on associated lesions: simplex, punctate, indurate, and rosacea. The first three types were identified as local lesions that require local remedies. However, rosacea was deemed a cutaneous manifestation on underlying stomach or liver problems. In 1903, The etiology of acne remained uncertain. Edward von Chapie wrote in Atlas der Handkrankheiten that many morbid processes conspire to favor the existence of the disease. A peculiar seborrheic condition is frequently present, which gives rise to the formation of comedies. Considers that specific significance contributes to various bacteria found in the pus of acne postulates in Wisconsin. While Greeks preferred vegetable-based treatments for acne, Egyptians typically opted for animal-based products. The one common treatment they used was honey. However, given its popularity with both civilizations to treat a wide range of ailments, this may be more conscious. Throughout the Middle Ages, the four humors that underpinned medical treatment and research was stifled by religious control. Treatment development stagnated and was based on balancing humors, diets, herbal remedies, and prayers. Botanical and herbal treatments were still used in 1936 as seen as cosmetic dermatology, a good guide on historical treatments. Goodman first stated the importance of a good history that includes information about diet, catharsis, periods, urine, blood sugar, ingestion of bromide or iodine tracks, blood pressures, headache medicine, nerve tonics, and sleep potions. Topical treatments were classified into keratologist, antiseptic, astringent, emollient, and keratoplastic therapies. Throughout history, much focus has been placed on dietary avoidance as a treatment of acne. McKee and his team advised in 1922 that avoiding candy, pastry, soda water, ice cream, chocolate, rich food, fried food, coffee, alcohol, and spices. In addition, Goodman advised to avoid starchy foods, bread rolls, noodles, spaghetti, potatoes, oily nuts, waffles. Goodman priced the following foods are suitable to cure acne: cooked and raw fruit, farina, rice, wheat, oatmeal, green vegetables, boiled or broiled meat, clear soup, vegetable soup. Conversely, Fulton et al. Showed that excessive intake of chocolate had no bearing on the composition or output of sebum production. McKee also stressed the importance of a daily bowel movement in the prevention of acne by stating that if there is indication of intentional troubles, the alimentary canal must be attacked. Avoidance of excess sexual activity was also cited as a potential therapy in treating acne. Furthermore, the menstrual functions and genital facts should receive attention when treating for acne. From 1895, when Wilhelm Röntgen discovered the use of X-rays in medicine, the spectra were used to treat a variety of conditions, including acne. In 1902, American researcher Pusey first published on the use of X-rays as a novel therapeutic agent in the treatment of acne. In the 1930s, researchers calibrated X-ray equipment to allow it to be widely used in the 1930s. Mackley and Cipollaro described X-rays as the most useful and important single agent in the armamentarium of dermatology. In 1947, Otto Isler with pharmaceutical company Hoffmann La Roche developed a commercial synthetic vitamin A. However, it was not until 1959 that dermatologist Gunther Stütgen worked with retinols for the treatment of keratosis disorders and discovered that retinol was effective after metabolic activation. Dr. Stuttgart's work with Hoffman LaRouche on drainage showed that it worked in the treatment of certain skin conditions. Albert Montgomery Kligman, professor of dermatology at the University of Pennsylvania and a trained botanist, also investigated acne and published the first paper on the use of topical retinoids. Treatments with isotretinoin was thought to be more effective and safer than tretinoin and revolutionization the treatment of acne vulgaris, as 9 of 10 patients saw a significant improvement in their skin after only a single course for 60 to 24 weeks. It should be noted that interest in acne treatment with tretinoin has researched oral isotretinoin is reserved for acne that is more refractory rather than controversial therapies. Tretinoin reduces the size of the pilosebaceous unit and dramatically suppresses immune protection, resulting in altered skin surface lipid composition. This mechanism results in the frequently reported side effects of monocotysis, grading of the ACE and expression. Side effects are those depends and occur in up to 95 patients. Diffuse hair loss and hair loss commonly reported side effects and resolve as discontinuation of the drug. Acne vulgaris is a serious disorder that can disfigure patients and affect the psychosocial health of teenagers and young adults. Although understanding of the disease has progressed well since the time of the Renaissance, research still continues. Isotretinoin has been a major life-changing advance in the treatment of this disease, but its teratogenic effects means it must be prescribed with education and care. Few studies have evaluated the prevalence of acne in non-westernized societies. However, there is suggestive evidence in non-industrialized societies that the incidence of acne is lower than in westernized populations. Schaeffer, a general practitioner who spent almost 30 years treating Inuit Eskimo people as they made their transition to modern life, reported that acne was absent in the Inuit population when they were living and eating in their traditional manner, but upon acculturation, acne prevalence became similar to that in Western societies.